presentation will be about the work I did in France for 3 years. It's with the title of Impact of Body Mass Index of Hepatocellular Carcinoma Recurrence after Liver Transplantation through a long-term follow-up. As we all know that HCC is the 6th common cancer and the 2nd in Egypt, and still liver transplantation is the best curative treatment for HCC, with HCC recurrence about 10 to 20%, a higher percent, with a poor prognosis. So still optimizing patient selection is one of our main aim to lower this risk. And globally, despite the recent progress in the treatment of viral etiology of HCC, now NASH is becoming the fastest growing indication for HCC-related liver transplantation, as we can see according to the European Liver Transplant Registry. So our objective in this work was to evaluate in a large cohort of transplanted adult patients the relation between the recipient body mass index at time of transplant and incidence and time of HCC recurrence, and also to assess the main outcomes after transplantation regarding overall survival, recurrence-free survival, and post-recurrence survival. So this study was done in the Centre Hepatobiliary at Bruce Hospital, Paris-Saclay University in France. It's a retrospective cohort study. They transplanted since 2000 to 2017 about 2,200 liver transplanted patients, 470 cases of HCC. Our cohort was 427 after excluding 42 cases of retransplant patient or combined organ transplant and data missed. The criteria for selection of the patient was Milan and San Francisco and their national French alpha-fetoprotein score. So we divide or classify our cohort into 3 groups according to the WHO body mass index classification, into group 1, normal and overweight and obese. The results, about 84% of the patients were male, with the main etiology of underlying liver diseases. About 31% was hepatitis C and 30% was alcoholic cirrhosis, and NASH was about 10%. So when we start to compare the patient characteristics among the 3 groups, we find that there was a significant difference among the 3 groups regarding the history of diabetes mellitus. It was high in the group 2 and 3 for sure, and the underlying liver disease, it was higher, significantly higher alcoholic cirrhosis and NASH in the group 2 and 3. The 3 groups had, or the patient there had child score CB, the majority of the patients. So regarding the post-transplant, the pre-transplant therapy for HCC, it was comparable. And the alpha-fetoprotein at time of first time of diagnosis of HCC, it was significantly elevated in group 1. Regarding tumor characteristic, there was no significant difference, but the majority of the patients were within Milan and having alpha-fetoprotein score less than or equal to. Regarding tumor characteristic at explant, there was no significant difference also. And the immunotherapy regimen post-transplant, it was comparable. So regarding the pattern of and the incidence of recurrence, it was comparable or comparable among the 3 groups. There was no significant difference, and the majority of patients developed recurrence in extrahepatic area, like it was common in lung and bone. Tumor treatment after recurrence development, it was comparable. So here, the overall survival for the patients, according to body mass index, it was comparable, no significant difference. Same for the recurrence-free survival. And even, although it's a very poor survival after diagnosis of HCC recurrence, it was comparable among the 3 groups, group 1, 11 months, 18 months, and 15 months respectively. So our conclusion was, this is the first study to closely examine the relationship between the body mass index and HCC recurrence after transplantation through about 17 years follow-up, showing no direct impact of the incidence of HCC recurrence, regardless the status of the patients and the tumor characteristic at time of transplant. Obesity should not be considered when selecting patients with HCC to transplant as a predictive factor of recurrence. Obesity and overweight are not necessarily associated with higher post-liver transplant mortality. HCC recurrence So instead of wasting time trying to reduce weight and decrease body mass index before transplantation, it will be better not to wait, and this might lead to increase MELD score. This work was published in the Hepatobiliary Surgery and Nutrition Journal, and it was presented in several conferences. Thank you.